Once a woman with Fabry disease is on therapy, the big question for both you, the patient, and the insurance company is how are they responding to therapy? The easiest way to monitor a response to therapy is subjective findings such as fatigue, changes in pain, changes in gastrointestinal symptoms, and decreased biomarkers. But you may say, Dawn, remember when you told me that women may not have increased biomarkers that are specific to Fabry disease? And I will say that is correct. So biomarkers may be helpful in talking to us about how a woman responds to Fabry disease. But if she began with normal GL3 biomarker levels in her blood as a baseline, then going to look at them again when she's on therapy is not going to be informative. And that's because if her levels are normal, they're probably not going to go lower when she's on therapy. That means you're going to have to look objectively. You need to look for changes in their health over time. You're going to look with echoes and EKGs. You're going to look at monitoring the renal function through blood and urine studies. You're going to talk to them and do specific measurements such as the SF36, which is a quality of life measurement that can look at subjective findings over time. You can look at the brief pain inventory, which is a methodical way to measure pain and changes over time. And even though these measurements are not perfect, they can give us more information on how things are changing for a woman as she's been on therapy for her Fabry disease. The fastest things to respond to most of our therapies are gastrointestinal symptoms. So they may still be occurring, but over therapy, primary therapy, they tend to be less frequent and less severe. And so when somebody is on therapy, they seem to improve, but may not go away. When they're off therapy, they come roaring back over the course of 3 to 6 months. So sometimes just the smallest thing that you may not even think about, such as monitoring how frequent and how severe the issues are, can help you monitor therapy and therapy improvement. There have been some great studies out on enzyme replacement therapy that have shown a decreased number of serious events. So serious events would be renal failure, strokes, death, heart attacks, and malignant arrhythmias. And when we look at the rate of those issues after a year, they did find a decrease in having all of those different serious health issues. But the most important thing to know is Fabry is a slowly progressive condition, and changes are also fairly slowly progressive. They may not have subjective findings that they feel when they're on therapy until they compare what they can do now to what they can do after a year on therapy. I think one of the most amazing stories to me was a woman who was 60 and began therapy as soon as it was available. And she came to me and she said, Dawn, after a year, I just realized how much of a change I had. Last year, I tried to cook Thanksgiving dinner for my whole family, and I cooked it. I didn't enjoy eating it, and I fell straight asleep right after, and it took me days to recover. This year, I cooked Thanksgiving, I ate Thanksgiving, I cleaned up from Thanksgiving, and then I enjoyed time with my family afterwards. And I was tired the next day, but it didn't take me that time to recover. So how do you encapsulate that difference? And the best way you can encapsulate that difference is by using just questionnaires and asking the same question to the patient. Then in your note, you can say, we've seen subjective improvements in energy level, in improvements in heat tolerance, decreased severity and frequency of gastrointestinal symptoms. These are the things that you monitor to see how well someone's responding to Fabry disease specific therapy.